So today we're going to talk about pregnancy, birth, and babies in relationship to craniosacral therapy.
So I'm pregnant, but how do I know if I need craniosacral therapy?
Well, in pregnancy it's really great to do anything you can to help your body prepare for birth and to help your entire well-being. So craniosacral therapy can be very good for just helping you relax. Many times, as you get farther along in your pregnancy, you start to get uncomfortable. It gets hard to, you're off balance basically because your belly gets so big and kind of pulls your spine out, and you can start to have aches and pains that you didn't have before. And so craniosacral therapy can really help your body come back into alignment. Preparing for birth, many times, we're excited about the birth, but we may have some internal fears that bring up resistance. And this may be from hearing stories from other people about their births that really were traumatic for them, or it could be that we've had other children and those births were traumatic for us at some level. And any of that, these thoughts and these feelings, these holding patterns, can definitely get in the way of having a natural birth. And so I can help you with that. I can help you come into relationship with how you hold those memories in your body and help things come back into that neutral where they need to be for you to have a safe and natural birth.
And how do I know if my baby needs craniosacral or not? I've heard sometimes babies need it.
Well, everybody's birthday is a very compressive day. So it really doesn't matter how you're born, there's some squishing going on. And the longer the labor, the more compression that the baby's body has to deal with. And the baby is curled up in a ball, and the uterus is pressing very, very hard over and over and over again on the baby's body, and this is causing this kind of axial compression into the spine. And it's all about our perception. So you as the mother, you could feel like, well, I had a great birth. Everything went wonderful for me. And it's possible that the baby has a different story because the baby was having a completely different experience than you were. Ways that your baby can tell you that, it's all very primitive for a baby. Of course, they are using expression, but they don't use words. And so what we'll see many times is that a baby might have trouble actually breastfeeding. And if they can't breastfeed, we have a real problem. If they can't latch on to the breast securely, then they can't transfer milk, and they won't be able to gain their weight. They might have trouble settling and sleeping. They might cry a lot. A lot of babies actually are off balance, literally, in their bodies, and they'll be leaning to one side, and they'll do this awake and asleep. And often parents don't notice. And if this is treated early, this condition is called torticollis, and there's different degrees of this, but it's pretty common. No matter what kind of birth the child has, sometimes it happens in utero. If this is treated early on, as the child's developing in its musculoskeletal system, it doesn't have to grow that way. So it actually starts growing around the midline as it starts to lift its head and do its push-ups and kick and move. The bottom line is that after a baby's born and it comes back to its mother, the mother's nervous system is what it's orienting towards. And the nervous system of a newborn is very underdeveloped, and it cannot self-soothe. So one of the things that's really important for parents to learn is how to stay calm, even though they have a newborn baby that might be crying a lot and having a high-pitch cry. And that's that baby asking for help. And there are many ways to help a baby, but as a new parent, you don't always know what that is. The number one thing that you can do is to calm yourself. Because if you can find a way to be calm in your own nervous system, that is about half the problem. And the baby will know it's okay because you're okay. So that's one of the things I work with new parents a lot is, how to help them calm down. And if they've had a traumatic birth or pregnancy, then it's going to be even more difficult for them to believe that, their baby is okay and everything's really normal. So that is all about your nervous system. That's about the parent being able to downregulate their own nervous system enough that the baby can attune to that in a healthy way. And the work that I do can also help the baby's nervous system downregulate from trauma. And in that sense, they'll be able to sleep, eat, and digest better. One of the other things that we do is really help decompress the spine, the cranial nerves at the base of the cranium that are in charge of digestion, breathing, even the sucking and the swallowing, all of this that needs space. And if the baby is cramped down from that experience of birth, they can't extend in this area, and these nerves have a hard time functioning. So a large part of what we're doing is making space in this little baby's body for greater function.
And how many sessions does it take to help a baby if it has a problem?
Sometimes, it's just a session or two, and sometimes it takes more. The common time that it takes to birth a baby is around 12 hours. Sometimes women think they're very lucky because they have their babies super fast. Maybe just a few hours. Maybe 6 or 3 hours. Well, that's considered really, really rapid. And it's very hard for the child to kind of integrate that experience. And then the other extreme would be if a woman's in labor for days. We also have today quite a number of interventions that are common. And these interventions could be that maybe a mom is late and overdue, and they will induce her labor with Pitocin. Pitocin is a very intense drug that usually will make the contractions happen, but it's much harder than what your body would produce. And so it's kind of too hard on mom, and then she needs some painkiller, and they often will use an epidural, which then makes it difficult for the mother to kind of move around. And moving around really helps the baby come down and the dilation happen and even the pushing. And so all these different things that the mom and the baby have to go through, they're really not the normal kind of 12-hour natural way, cause layers of experience. And so just kind of depends on how many layers you're dealing with as to how fast that healing can happen and how many sessions it will take. What I usually ask parents to do is to come, if they've had a very long labor or lots of these interventions or spent time in the neonatal unit, is that they come for 6 or 8 sessions. And I feel like we can make a lot of progress in 6 or 8 sessions.
at you. Here. Is this you kicking? Kicking. Very good. Yeah. So sweet. Are you ready for it again? You thinking about it? Are you thinking about it? Okay, here we go. Here we go. There's my hand.